Many people have lost loved ones to suicide and are battling to make sense of the situation. Others are in a state of despair and helplessness and are considering taking their lives. I'm news editor and journalist Melanie Moses, and today I'm joined by clinical psychologist and author Dr. Rani Samuel. Our hope is that this podcast will help bring perspective and provide some answers to the questions that so many people are grappling with. Rani, welcome. Help us zoom into the mental state of someone who's suicidal. What does it look like?
If you can imagine someone standing on top of a burning building, trying to make a decision as to whether to wait for help or to jump, is very much like what goes on in the mind of someone that is suicidal, because actually their life is on fire and they can't see a way out. And in their minds, they have this mental balance sheet. And the problem with this mental balance sheet is that it is driven by emotion. So it's not a very logical process when your life is on fire.
So at this point of mental chaos, it must be really difficult to see reason.
A suicidal patient undergoes a filtering process in their mind, and they see most things as negative and supporting their decision to end their lives. It could even be simple things like the weather. It could be phone calls. It could be watching the news. And everything suddenly becomes intense and takes on new meaning.
Do they battle to believe that they're loved and valued?
Most patients that feel suicidal or have attempted suicide feel like a burden. They feel hopeless and helpless and depressed. And their mind is clouded in this type of thinking. And what it usually leads to is very poor judgment. Because when you are experiencing intense and high emotions, judgment actually goes out of the window. There are other things that we have learned about suicidal patients from the suicidal notes that they leave behind. And this gives us some clues as to what was happening in their minds. And interestingly, many of the notes that I have read over time is actually very disordered, not very logical. But the one thing that is clear, it is filled with shame, it is filled with guilt, also apologies, a high amount of psychological pain, and the person often asks for forgiveness.
Once someone has taken a firm decision to commit suicide, is there anything that anyone can do to stop them?
I think that's a very important question, because most of the people left behind after someone ends their life by suicide ask that question. Is like, could I have done something? Could I have intervened? And that's not the easiest question to answer. Because sometimes, yes, I can give you case after case where I have been involved and where a neighbor comes and knocks on a door and someone will actually change their mind. I want you to know that a lot of the time, people don't actually want to go through this. When we sit down as psychologists with patients that are now in ICU and were not successful, many of them tell us they really didn't want to do it, but it was a desperate attempt. It's like I said, it's a building that's on fire and you have to jump. But alternatively, I've also seen cases in my many years of clinical practice where someone is completely determined to end their life. And no matter what you say or do, it has no impact. Quite often in the hospital side of practice, many patients will actually refuse to see a psychologist because they have decided that they want to end their lives. And that's all they want to do. And it becomes an act of will, and there are limits to even what we can do as healthcare providers. So that decision sometimes is unerring, and nothing we can say or do has impact as health professionals.
Who is most at risk of suicide?
I think there's definitely research to support the notion that a person that's high risk for suicide is someone that has had previous attempts at suicide. The other factor is there's a family history of suicide, so all that comes into play. I think most often it's the unhealed person that will try again and again. So that's why it becomes critical to do everything, to use every type of treatment process to deal with the depression that is quite often underlying everything. But yes, if someone has hidden this, has refused all kinds of help, there's a high possibility that they will attempt suicide, and there's a high possibility that they will actually die by suicide.
Tell us about parasuicides.
Every suicide attempt is a cry for help. We have a section in clinical psychology that is referred to as the personality disorders. And some of the features of certain types of disorders is a tendency towards what we call self-harm. So there would be suicide attempts, and maybe it wouldn't be so serious. And many of that we call parasuicides. But each parasuicide is a call for help. So when someone comes to us, and it's interesting, it usually happens over a weekend, we have a high number of parasuicides. And when we go in and assess and make a full diagnosis, every person attempting suicide is offered psychotherapy and to engage a full treatment process.
So it seems like having suicidal thoughts is far more common than most of us realize.
When I sit with any number of patients at any intellectual level, at any social level, and if you have a meaningful conversation and you say to somebody, do you ever feel like you just like to sleep and never get up when you think of all your problems? Most of them, in the confidentiality of my office, will say yes. And it's a relief for them to say yes and talk about this to somebody. There's a huge stigma about mental health and even talking about suicide. There's a huge silence around it. So it is far more common than we realize.
Are most suicides planned, or is it a spur-of-the-moment decision?
A lot of people feel suicidal, but not everybody has a plan. So those that in general complete the act are people with a plan. They have thought about it. They've decided where, when, and how. They have often left notes. And therefore, it's such a thought-out process. And many people will report that I met the person yesterday and they were looking so normal. They were laughing and talking to me. We sat down and had a cup of coffee. We had a phone call. And the only reason that is the case is because the person has already decided to end their lives by suicide. So sometimes their state of mind is, I don't have to be a burden any longer, and I'm going to do this. But most survivors tell us how terrifying that is. I also want to say that over the years of practice, I've seen many people who have survived make lives even more difficult for themselves. I'll give you one example. I treated someone who shot themselves in the head and survived. This person was depressed and had all their problems. Now they had lost an eye and had a certain amount of brain damage. I have spoken to people who have driven their cars off bridges, who attempted to drown themselves and all of it and survived. And now you have all your problems plus new problems of a physical kind. So therefore it's critical for people to actually reach out. There are so many solutions that most people have not tried.
Absolutely. Rani, we've seen many cases where people appear to have made the decision to take their lives literally that very day. Their Google search history, for example, brings up questions that they typed that very morning. Are you saying that even in cases like these, it was probably a long thought-out process?
I think what would be important there is to look at the full history that has happened in this person's life. When they make a decision, there's a shutdown, there's this filter. Everything is triggered. But my experience as a psychologist has shown me that this is years in the coming. And I don't know to what extent this person has had full treatment, been on antidepressants, admitted to hospital, worked with a psychologist or a psychiatrist. We find that when people have engaged a treatment process, we don't have those sudden incidents because we are facilitating a healing journey with them. But it is possible that someone can do this at the spur of the moment who has been untreated.
Many comments are made and questions asked after someone has taken their lives, like, how could this person have been so selfish? Did they not think about their families, their children? They had so many friends who cared. Why didn't they reach out for help? Help us understand why.
The mindset becomes quite disordered. So a lot of people who attempt suicide could also be having a psychotic process that's busy going on. It's not a rational process. It's not a logical process. When there's such intense high emotion, judgment suffers. So it's not good judgment. So in their minds, they have this disordered thinking that the world is better off without them. They feel like such a huge burden. They actually believe that the spouse and the children and their friends and family will be better off and they will no longer be a burden to these people. And actually, that is so far from the truth of what suicide actually does to a family. It completely devastates them.
Let's talk about that. Does the family left behind ever really heal?
It is a completely devastating experience. It's a complete wipeout for the family. Quite often, it comes as a shock. So it's like an emotional tsunami has washed over them. It is worse for those who come home and discover. They may discover the body, they may walk in and find the person had an overdose and they cannot revive them. So that's a different level of trauma. But everybody who knows this person, every loved one, every neighbor and friend and colleague suffers greatly. I once heard the analogy of suicide being like a suicide bomber. You've detonated yourself, but the shrapnel has gone into everybody. So the pain has actually been spread around to every single person that knew you or loved you. In my years of clinical practice, I have seen people who have never fully recovered from the suicide of a loved one. They would sit with me in their 60s, 70s, and 80s and tell me about a parent that killed themselves through suicide. So that takes a tremendous amount of work. And of course, there's some questions you're never going to know the answer to. The why question, it becomes like a spiral question. And then family is left with the what if question. What if I did this? What if I came home earlier? And there's some answers nobody will ever know because it left with the person. So I would say family needs a lot of support, a lot of intervention, a lot of healing needs to happen. And they do come after a period of time, after there's immense grieving. They will come to having found peace about what has happened. Doesn't mean the pain goes away forever, but there will be peace.
I've seen many families suffer guilt, asking exactly that, what if? Constantly saying, I could have done this or I should have done that. How do they deal with this?
Yes, there's a lot of guilt because you could have had a disagreement with that person. You could have been going through marital problems. So there'll be a lot of disagreements and a lot of fights at home. There could have been a lot of name calling. So there's a tremendous amount of guilt. So the brother or sister could feel, I should have phoned them. I should have delayed this. What do you do with that guilt? Sitting with people who hold the guilt, I would often ask them, I say, do you blame the mother for what has happened here? And they'll be like, no, I don't blame the mother. I said to them, do you blame this person's child? They were like, no, it's unthinkable. How can you blame the child? Do you blame the boss? And they'll be like, no, it was a difficult relationship, but this is nothing to do with the boss or the pastor or the best friend. And then, of course, they would ask the question, so why do you blame yourself? If nobody else, you don't blame anyone, why you blame yourself? And I think that question is often quite the turning point. But I also think there's a lot of room for forgiveness in it, to forgive others and to forgive yourself.
I find when men commit suicide, the wife is often blamed. How do women cope with the daggers of blame?
Listen, the wife gets blamed for a lot of things, and that's quite historical. And yes, people will want to shift blame to the person's spouse or partner. And I think that's where the healing journey begins, because inside, the part of you also blames yourself. So you have to deal with this. But what I find is that sometimes, and quite often actually, suicide is an act of will. Every day we choose to live or we choose not to live. And I've learned over the years, I actually can't change somebody's mind once they decide. I'll give you an example. We once treated a young woman who had suffered a breakup, and she came to hospital through a massive suicide attempt. And when she was in the hospital, she tried to strangle herself with the drips in the hospital. So she was determined. And what we did was we put her in what we called our contained ward, our lockdown ward. And I worked with her for days. And she was just determined that she's going to do it. But we settled her down. And then her family came and took her out just for a lunch and to go home and get a fresh set of clothes. And when she went home, she hung herself in the bathroom. So in terms of blame, I had done everything I could. The family had done everything. And it was very hard to blame anybody because we had all reached our limit and point of what we could do. And this person had decided, I am going to die. And it was like trying to, shifting someone's will is like shifting a brick wall. You cannot do it.
Can anyone really be blamed for an act of suicide?
In my experience, this was an act of self-harm. When someone murders somebody, that's a whole different understanding. So I think it is a question that people needlessly spend their time on because you're actually not going to get a final answer on that. And therefore it's critical those left behind engage a healing process and work through these questions with somebody and find peace with it. Otherwise, you will just continuously go in circles. Because if our goal becomes healing, then we have to accept that there's some answers we're actually not going to know now. And that is quite difficult for people because people want to control those answers.
Rani, has the face of depression changed? We used to be able to tell when someone is depressed. They looked sad and downcast. Now it seems that so many people wearing smiles and socially active are actually in deep depression.
All of us wear masks, and there is a private life and there's a public life. Perhaps the public life is so extremely well masked at the moment with social media, what is portrayed there, and our experience of that particular individual in our office is completely different. So I'll give you an example. Recently, a woman showed me a picture of her family, and it was these beautiful pictures taken on a beach, all of them in white and blue, smiling. And I said to her, that's a really lovely picture. And she said, I'm crying inside. He just said something so awful to me. And I know I'm going to divorce him in a year from now. And she said, this picture will fool anybody because we look like a beautiful family. This is something we have always known. I just think the masks have gotten more creative.
Wow, that really makes sense. Elaborate on the role that social media plays in this regard.
Everyone wants to be somebody important. And what does social media focus on? It focuses on the image. People have role models, and these role models portray life in a particular way. Very often we don't look behind the image and behind the role. And you brought up the example of Ricky Rick. We didn't know the extent of his suffering. People looked at him and thought he had it all. And we see that in a number of so-called local or, Hollywood celebrities that took their lives. We actually don't understand the full extent of anybody's pain. So I would say to people, take social media breaks. Use it for the right reason. Educate yourself about this. Try and imagine what their life is behind the images that you actually see. As psychologists, we have a strange eye for these things because we would say to each other, well, look at what we've seen on social media of somebody, but we know during the week they will be sitting in tears in our office. So I'm saying be more circumspect. What you see very often is not real. And it would be interesting to have a life away from social media for a period of time, and I would encourage that.
What about the type of music we listen to?
I think there's various opinions about that. For myself, as a psychotherapist, I have found music gives me a lot of clues on who somebody really is and what's on their heart and what's important to them. So in my line of work, I have listened to every type of music. People give me songs to listen to. They bring me lyrics to listen to. They would bring me rap lyrics to listen to. But the whole idea is to sit down and understand why that song is important to somebody. So I don't think it's about a blanket thing that music can just cause this, but it's to understand the why behind it.
Now, from my research, many people who came really close to taking their lives have spoken about hearing voices in their head. In fact, rapper Ricky Rick, as you know, left a suicide note in which he said, "The voices in my head have never gone away." How do we explain these voices?
I think there's two ways of looking at that. The one is, depending on the type of mental health diagnosis somebody is dealing with, auditory hallucinations are very real. People sit in front of us and tell us that the voices are giving them instructions. Sometimes they are known voices, sometimes they are unknown voices. So this is something we're quite used to dealing with. So if you're dealing with someone that's experiencing a psychotic disorder, a manic episode with psychotic features, we have to test for all of these things because voices can actually tell you to go to the top of a building and jump. So we've had a lot of that. And quite often this responds very well to medication. We bring someone to hospital, we settle them down, the voices do settle. I think on the other side, there's also a possibility of spiritual explanations for this type of phenomenon.
Tell us about that.
I can only speak from a biblical point of view because that is my frame of reference. And what I would like to share is that we have a concept called suicidal contagion. Apart from being well documented, it's actually very poorly understood. And suicide contagion is where one suicide triggers a host of copycat suicides. And you think of the why. I mean, why does this happen? What I've seen with my patients is that they become extremely powerless. When you talk to somebody that's feeling intensely suicidal, there's a distinct powerlessness about them. And I've sat with many people in the psychiatric wards. And in psychology and psychiatry, we have what is called a scope of treatment. And for those that have worked for many years, we know there's some things that go beyond the scope of treatment. These people are not going to respond to the medication. There's something going on that our diagnostic tools don't allow for. Because I'm someone that's grounded, in the Christian faith, I've searched for answers. Psychology has a distinct role, but there are some things beyond that we also deal with, especially in suicide. I would encourage people to go back and read the Genesis account of how we are created, because you will find that we are spirit, soul, and body. And as psychologists, we are practitioners of the soul, which is suke. But what we find is spirit is a gift from the person of God. And the soul is where the emotional life and heart issues actually reside. If we ever open to dark spiritual activity, it's going to be in our emotional life. And the goal of fallen angels, when they start manipulating your emotional life, it has only one goal, which is to rob, kill, and destroy you. And the soul and emotions can be impacted by dark spiritual activity. One of the ways is through generational issues that we carry, and the other means is actually through trauma. So it's critical to understand that sometimes suicide has a distinct spiritual dimension. And that needs to be treated by people who understand the mechanics of that, because it can be treated. If your life is ruled by the word and the spirit of God in you, there is no space for a dark, demonic spirit in your soul. And that can be removed and dethroned, and you can be free of that.
Share with us what happened among teenagers in Pietermaritzburg.
Several years ago, I lived in a city in the Midlands called Pietermaritzburg. And during that time, there was a spate of suicides among the youth in a particular area. So it started with one, and it very quickly escalated to over 15 suicides in a 3 or 4 month period. So I was part of that intervention to go and speak to the students, to debrief people, to work out what is actually going on in that region. To me, when I look at it now, it is part of the suicide contagion. And I think a very good example of what the spirit of suicide from a biblical point of view looks like. Because it can spread. These kids, many of them had not thought about suicide before, but when the best friend did it, and it just continued spilling over and spilling over. So when we intervened on that, we came at it from all directions. So it was psychological, it was educational, we helped with closure, and at that point in time, the church was distinctly involved as well.
What would you say to someone listening today who's feeling suicidal?
Wait and let's explore every treatment option possible. I would question whether you have tried every option possible, because I have seen people recover from the most severe of depressions. I have seen people come to hospital and lie in bed and not talk to me for 5 days and just tell me they want to die. And I've seen people come out of that, heal, and go on to lead fully effective lives. So I would say go and see a doctor, see a psychologist, see a psychiatrist, take antidepressants. See if it works for you. It is not a cure for everything, but if you haven't tried it, what do you have to lose? And see someone that knows how to administer this medication accurately. If you need to be admitted to hospital, go and do that, because the act of suicide is so final, we can't do anything about it. Sometimes people are so severely depressed, we undergo ECT therapy. And if that shakes you out of your depression, it's worth doing it under the guidance of trained professionals. So do everything is what I would say. It's a combination factor. And that's what we win by. You know, you often hear of people talk about you are the architect of your own destiny. I would completely disagree with that. I'm not saying don't be active in the pursuing of your goals, but from a biblical point of view, you are not the architect of your own destiny. Not one of us has the ability to give or take life. Your life does not belong to you. It belongs to your Creator, who is the God of all things. This God created you and everything that you see around you. I'm not talking about religion here. I'm talking about a personal relationship with the God of the Bible. So go and reread the creation account, and you will realize that humans were created to carry the presence of God. That means you and me. No other creature on this planet has that capacity. Your spirit and the gifts that you are given, your unique purpose, was known in the mind of God even before the earth was created. So you are no accident. You are chosen. And to prematurely end your life means that you will not fulfill the divine potential that is deposited in you. And that would be the saddest thing for all of humanity. So I'd say to you to live, do everything to heal your suicidal thoughts. Reconnect with your purpose, the reason that you were born, the reason that you were sent to touch humanity in a unique way. Humanity will be incomplete without your presence in the earth. There is a time for everything, so every day of our life is numbered. God decides when we enter this world and when we exit the world. Don't take that decision into your own hands, because your life is not your own.
Now, for someone in a low space, it's a big ask for them to firstly acknowledge that they are depressed and then to find the energy to pick themselves up and reach out for help. In that space of despair, are they able to take that step easily?
I think we spend so much time in denial about depression. And not all of us are trained to recognize depression. And I think we live in a society where we just tell people, oh, you're just having a low day and this is just the blues, or, you had a hard week. Depression is something more insidious. So you have a low mood, and that low mood persists. And it doesn't always have to be a chronic low mood, but you start losing interest in things that you used to enjoy. So maybe you were someone that ran marathons and suddenly you actually don't even feel like going for a run down the road. Your eating would change. You could eat more, or you could have significant weight loss. You could become increasingly tearful. Your mood, you can be irritable. A lot of depressed people are angry people. So this is something worth educating yourself about, because most people cannot tell when they are depressed, and you often need a professional assessment for that.
What role can families play to help their loved ones?
We're not all experts in this. If someone was having a heart attack, we're not all cardiologists to look at the warning signs. So I think it's quite a responsibility to put on other people, except people who know and people that are trained in this. But there is sufficient information online to actually go and read and see what changes in behavior you are experiencing, and then to reach out and say, I'm going to actually deal with this. And the first port of call can be your family practitioner. Many of them are trained to actually do the crisis intervention, or go to your local pastor, go to a religious body, phone a helpline, get information. But it gets quite difficult when you're dealing with an adult, because they can shut down and refuse your help, and then it sort of ties your hands behind your back. But everyone's got someone that they're willing to listen to, and they have a best friend that may be able to talk to them. So I would say that it's a lot about encouragement. I can encourage people and say, you know what, I will come with you. Let's go together. There are sufficient community clinics. There are support groups. There are phone lines. You need to see what is available at your local clinic or hospital. There are options if you look. But you have to be incredibly patient, because people are not that open to coming for help.
Is a strong support structure the key?
I'll come back to nothing is as it seems, that people mask incredibly well. I don't know what a best support system would look like, because the person that may be your so-called best support could have just got a medical diagnosis the week before, and they could share it with you or not. So people's lives are changing every day. But yes, there are some people we can turn to. Pride is a strong word, but I think it's about the burden, that you don't want to be a burden even to your friends, yet your friends would so willingly help you and go forward with you. They call psychologists the keeper of secrets, and we know things about people's lives that actually nobody else knows. And when you unpack, almost like a CSI agent, when you unpack somebody's lives, there are so many things that nobody else ever knew. I have sat and read through transcripts of WhatsApp, for example. Partners brought me a year of transcripts, and someone had a whole secret life that nobody actually knew about. And when you look at that and you look at the outcome of what has happened, it makes perfect sense. So yes, it's wonderful to have support, but all is not what it seems, because everyone in that group could be struggling with something.
There's a big shift towards encouraging men to reach out for help. Are you seeing more men willing to talk about issues affecting them?
I think the stereotype is that women are more willing to talk about emotional issues, how they're feeling. The stereotype is that men must be strong, men must be silent, men must deal with things on their own. And yes, we need to encourage men to find their support. It may be in other men, it may be in a best friend. The tide is changing on that one, certainly. In hospital, just as many men are getting admitted. In my practice, I see many men that come. They suffer the same issues as women do. There's no distinction on it, but perhaps there's a harder stigma on them because they feel so-called weak, but it's not a weakness to come for help, because now you're doing something about your life. None of us need to be that strong. We're only human in this.
What would you say is the turning point during your discussions with those contemplating suicide?
Quite often, I sit with patients, young and old, who tell me that they are definitely going to end their lives. And then we engage in an unusual discussion, because I would question them and say things like, okay, so you want to leave Earth. It's so terrible to be here. Where actually do you think you're going to be going to? And quite often they would just sit quietly and say to me, I actually don't know. Then we would talk further, and I'll say to them, okay, so you don't know where you're actually going to be going to, but you seem to be in a rush to get there. And that sparks quite a lot of new thoughts, because they haven't actually sat and thought deeply about the afterlife. What is it? What does it mean? What is on the other side? What will that experience be? What does it mean to die naturally? What does it mean to die by suicide? And what impact that has on where your spirit would be going. And these are very important things to think about. And when I sit and talk to patients about that, it's often they say to me, okay, I don't know the answers to these things, so let me continue to work with what I do know. And that often leads to a catalyst. We start increasing the momentum of the healing process.
Well, this has certainly been a thought-provoking discussion. You've given us a lot to think about. Thank you so much for sharing your time and insights with us. For those listening, we hope this recording will help you through your process of healing.